Can you help my viewers understand the picture as we have it today in the hospitals, ideally focusing in on England, because as I just mentioned, Jamie, the policy that I'm currently discussing affects England. It's not happening in Wales or Scotland or Northern Ireland right now.
Yes, Michelle, good evening. It's a pretty similar picture actually across all the four nations, but focusing specifically on England. What we've seen with the kind of the Omicron variant coming on board over the last month or so, and we had those early signs from South Africa, it was less deadly. It's quite clearly borne out in the facts and figures. We've got the lowest number of patients in intensive care now in England since we've seen in July. And because Omicron's so transmissible, we do also see quite a high number of people who are in kind of hospital who are in with COVID, but not specifically for COVID. So the situation overall in the hospitals has improved quite a lot over the last kind of month or so, and it's definitely coming through as a less deadly.
And Jamie, people watching this will say, well, hold on a second, this is about patient safety. So when it comes to transmission, if somebody is unvaccinated or not fully vaccinated, there will be the argument that those people are more likely to transmit COVID. What are the statistics around that?
Yeah, so the ONS kind of do a survey, an infection survey, and they look at the kind of the relative risk of catching COVID, and they've compared two groups. So they've looked at the people who've had vaccines versus those who haven't had a vaccine, and another group who are people who've had a prior and those who've never had COVID. And what we see is that you are reduced chance of catching COVID if you've had a triple dose, so 40% chance, less chance of testing positive if you've had 3 doses of the vaccine versus somebody who's unvaccinated. But that's not the full story. If you actually look at people who've had COVID and those who've never had COVID, there's a 60% reduction in the chance of catching kind of COVID or testing positive for it. So, many healthcare workers would be in the category, they've been on the front line. Loads of them would have caught the virus. So it's not as simple as just saying a healthcare worker is unvaccinated, so they're more likely to kind of catch it. You've also got to consider the fact that many of them would have already had COVID, and that does offer some protection as well.